Today we will be covering a foot and ankle impairment known as medial tibial stress syndrome, commonly referred to as shin splints. This impairment is especially important for runners because the repetitive impact forces during running place a large amount of stress on the shin bone and the surrounding muscles. If not addressed properly, it can cause significant pain, limit training volume, reduce running performance, and even lead to more serious conditions like stress fractures. Next, we are going to observe the overhead squat assessment, which will demonstrate the movement dysfunction in the foot and ankle. As you can see, there is excessive pronation or foot flattening, and the knees are slightly moving inward, otherwise known as valgus. During the overhead squat, these compensations suggest muscle imbalances at the foot and ankle complex. Individuals with medial tibial stress syndrome will notice overactive muscles like the soleus, a muscle in the calf, which will become tight and restrict proper ankle dorsiflexion, causing compensations like foot flattening or pronation. The perineal muscles will also be overactive or tight. These are located along the outside of the lower leg, and they will promote excessive foot eversion, leading to instability. At the same time, important stabilizing muscles like the posterior tibialis and medial gastrocnemius are underactive. Posterior tibialis is responsible for maintaining the arch of the foot and controlling foot motion. When weakened, the arch will collapse, leading to overpronation and increased stress on the medial tibia. The medial gastroc helps stabilize the lower leg and knee. When underactive, this lack of support can contribute to poor lower extremity alignment during activities like running. The first step in the corrective exercise continuum is inhibition, which aims to reduce overactivity and tension in those tight muscles. For medial tibial stress syndrome, we're going to be looking at the soleus and the perineals. I will foam roll the soleus by slowly moving back and forth over the mid to lower calf. I will shift to foam rolling the perineals along the outer leg. When finding any tender spots, I will pause for about 15 to 20 seconds to help relax the muscle tissue. Foam rolling should be done for 30 to 60 seconds per muscle. You should do this for 1 to 2 sets, 3 to 5 times per week using slow and controlled pressure. Keep in mind this was done with a yoga mat, which could help regress into a softer surface if the pressure is too much or the muscle is too sensitive. Or you could progress into more pressure by stacking the legs. This is important because it reduces overactivity and tension in these overactive muscles and allows for self-myofascial release. The second step of the corrective exercise continuum is lengthening. For this, we will be doing a static gastroc stretch or a wall calf stretch. This starts with your back leg being straight and your heel down that is being stretched. You want to do 30 seconds per side, and you want to do 2 sets, and you want to complete this 3 to 5 days per week. And the purpose of this stretch is to improve flexibility and restore normal length of that muscle. If you want to progress with the stretch, you can elevate your front foot slightly or hold it for longer. If you want to regress the stretch, you can bend your back knee slightly. The third step of the corrective exercise continuum is activate. For this, you will be doing isolated strengthening of the posterior tibialis. And the purpose of this is to activate the weak stabilizers of the foot. So you are going to be in a seated position. You are going to put one foot on the ground, one over the opposite knee, and you're going to invert that foot while pushing against it with your hand. You can put lighter pressure if you want to regress the exercise, or you can use a resistance band to progress the exercise. You will complete 2 to 3 sets. You will do 10 to 15 reps per set, and you want to do this 3 to 5 times a week. And the goal of this is to produce better arch support and reduce shin stress. So for the fourth and final step of the corrective exercise continuum, you will integrate. So you will complete a step up to balance. So you will step onto a platform, drive your opposite knee up, and hold that balance for 2 to 3 seconds. You want to be looking at where your foot and knee and hip are aligned, and complete this movement controlled and stably, so slowly is better. You want to complete 2 to 3 sets. For every set, you want to have 8 to 10 reps per side, so that means per leg. And then you want to complete this like the other exercises and stretches 3 to 5 times per week. If you feel the need to regress this exercise, you can lower the step height as seen above, as well as skip balancing. And while progressing this exercise, you can actually use a Bosu ball or add light weights in your hands while balancing. And the purpose of this is to improve dynamic stability. The purpose of the continuum is to identify and address movement impairments and improve performance like running.